Well, welcome to this month's podcast, and I'm super excited that actually this time I'm in person with my guest, Dennis Olodi. So good to be with you.
So good to be here.
Dennis is the Executive Director of the Uganda Cancer Society, where we are actually present delivering our Relay for Life training. But we're going to continue our series of exploring our partners around the world. So, Dennis, tell us a little bit, an overview of the Uganda Cancer Society.
Uganda Cancer Society. First, I have to thank you for this show. Welcome to Uganda.
Thank you.
Uganda Cancer Society is a coordination network of cancer civil society organizations in Uganda. It was founded in 2011, first by 5 organizations, and over time it has grown to more than 48 organizations.
Wow.
We have membership at national level, at subnational level. Then we have some of our members operating at continental level, and we have other members in Europe. In Europe, we have Uganda Cancer Trust UK, Solitaire, and Afron in Italy.
Wow. Okay, that's a big reach already.
Yes.
Fantastic. So tell us a bit about the impact of your work here in Uganda.
So basically, we have 5 program areas. We have advocacy, research, patient support, awareness raising, and capacity building.
Okay.
So those are our thematic areas. So Uganda Cancer Society does largely coordination. So most of our work is done by civil society organizations who subscribe to Uganda Cancer Society. But I should say, over the last few years, we've been doing a lot of capacity building, targeting civil society, and also healthcare workers in government facilities. Last year alone, that is 2023, we trained more than 72 from across the country. Yeah, that was last year alone.
Fantastic.
We have also been involved in policy advocacy. Recently, we developed a position paper which we submitted to the Ministry of Finance. We also had a National Cancer Symposium, which is a biannual activity. And we had the Prime Minister of Uganda as the chief guest last year. A number of commitments were made by government, and we're still tracking that. We are hopeful that next year, when we have another National Cancer Symposium, we shall have the President of Uganda as the chief guest.
Fantastic.
We've also been making a number of proposals to government through Parliament of Uganda. Recently, we presented a position paper to the Parliament's Budget Committee. So we were given an audience, we presented to the Speaker, and our view on the National Health Insurance Scheme has been considered by government. So last week, a report was sent back to the Parliamentary Council, an office that scrutinizes all legislations, and we are hopeful in the next 1 month, the bill will get back to Parliament. So we have done a lot of things. Currently, we are working on a National Cancer Control Plan. The WHO recommends that member states should have National Cancer Control Plan to coordinate, to streamline coordination. Uganda does not have one. Uganda Cancer Society, together with the Ministry of Health and Uganda Cancer Institute, have been spearheading development of the National Cancer Control Plan. We have been supported by American Cancer Society, the Union for International Cancer Control, and the Commonwealth Foundation through financing to support the process of scaling up advocacy for the National Cancer Control Plan. And I should say, in the month of August 2024, the Minister of Health, who is the custodian of that, obtained a copy, provided comments, and we have now incorporated her comments. Anytime next week, we're going to be submitting to the top level at the Ministry of Health, and then the document will be adopted at that level.
Wow, yes. You're making some great impact. That's so great to hear. Yes. So tell us a little bit about the cancer situation here in Uganda. What things are going well? We hear some great work that you're already doing and influencing the government. What are some of the challenges that you see specifically here in the cancer situation?
First, we are registering a spike in the incidence of cancer in Uganda, with more than 32,000 cases registered as of 2022 and 22,000 deaths. And there is a projection, according to the WHO, that if something is not done to curb cancer, then by 2040, we might register 77,910 cases in the country.
Okay.
So that has been because of many factors. One is insufficient allocation cancer. Government has over time increased funding to cancer, but that funding is not enough. For example, this year, 2024, government has allocated about 60 billion shillings, which is about 20, I don't know how to convert it dollars, but that is 20 billion Uganda shillings. Out of these, 400 million shillings will be going to cancer prevention. So it is not even 4% of what government is allocating. So we have a very big problem here. Two is institutions. For many years, cancer services were largely centralized in the capital of Uganda. Government came up with a plan in 2016 through a manifesto of the ruling party, and later in 2021 through the manifesto of the ruling party on page 317 to establish regional cancer centers. So currently we have a regional cancer center operating in the northern part of the country. There is also a center in the western part of the country. We are now going ahead to have regional cancer centers in the east and another regional cancer center in West Nile. And I should also say that this was captured in Uganda Cancer Society's strategic plan as well as advocacy plan, that by 2021, we should have regional cancer centers. And by the time we completed implementing the strategic plan as well as advocacy strategy, we already had 2 regional cancer centers. What we lack currently is also data for evidence-based decision-making and also for policy-making. Uganda lacks a national cancer registry of international standard. So what we have are population-based cancer registries. And this presents a gap in terms of evidence-based policy-making because we don't have the data that can help us make a very strong case. And that is an area of need. 4 is, in as much as survivorship is fully coordinated by Uganda Cancer Society, there is no policy instrument that seeks to streamline or mainstream cancer survivors as part of healthcare workers in the country, because survivors can provide peer counseling as well. And that is an area that is a very strong gap.
Sure.
Yes. There are many factors I could speak on and on. But I think over time as a country, there are a number of things we have achieved, starting with decentralizing cancer services, but also having a number of hospitals open to support interventions. Currently, we have level 4 hospitals, about 290 spread across the country. But in terms of capacity to manage cancer, it is still lacking.
Yeah.
Yes.
One last thing, I've had the pleasure of spending 2 days with your very dynamic team. It's been an absolute pleasure working with you. We're setting up Relay for Life here. What are your initial impressions of Relay for Life and your thoughts for here in Uganda?
Wow, Relay for Life is a very good program to us because it presents very strong pillars premised on 3 things. 1, celebrating survivorship. 2 is remembering those that we have lost to cancer. The 3 is fighting back. And fighting back resonates with what we do as Cancer Society: mobilize resources, build coalitions, build strong collaborations, do intensive advocacy, create awareness, and support survivors to reach out to the wider community.
Fantastic. Thank you so much for your time.
Yes.
And we'll continue talking.
Thank you.
All right.
Thank you.